Hi, my name is David Montgomery, and today we're going to be going through the lumbar spine examination. Thank you very much, Keena, for agreeing to be our willing participant today. So to start the examination, just ask you to face the wall. We'll begin by inspection. So we want to look for the alignment of the spine. We want to see there's normal alignment. You can see here that it's quite straight. There's no evidence of scoliosis. We also want to look at the muscle masses, and we can see that there's no evidence of hypertrophy or atrophy. Then we want to take a step to the side and look for the curvature of the spine. You can see there's normal lumbar lordosis going into normal thoracic kyphosis, and again into normal cervical lordosis. So then in this position I'm asking you to bend forward. So we're assessing the range of movement and deflection, and this can also exacerbate any sign of scoliosis where one side may be raised in comparison to the other. If this position causes pain, it may be suggestive of a disc pathology. And sit back up. Yeah, good. Now we can go on to do the stork test, also known as the single leg extension test. So you can stand on one leg for me and then arch backwards. If this causes pain, and relax. If that causes pain down the side where the foot is down, that's suggestive of SI joint pathology or spondylolisthesis, or also known as Parr's defect. So having performed that test, we would of course always perform on the other side as well, but for the interest of time throughout this examination we'll be just focusing on one side. Okay, so excellent. So now next we'll move on and we'll begin palpation. So we want to palpate the entire spine. So we start in the cervical spine, palpate down. You're looking for any evidence of tenderness, so let me know if you feel any pain. Okay. Next, we want to palpate along the paraspinals. So this is looking to differentiate between a paraspinal cause of pain and a spinal cause. When we get down to PSIS, this is the transition from lumbar to the SI joints. So we palpate then into the SI joints, and at the bottom, the V of the sacrum, we can palpate the attachment of piriformis. We then move into the gluteus muscles, and we can palpate over the greater trochanter. Now we can ask if you can just arch your back. That's good. So we're looking for the degree of lumbar lordosis that can be achieved, and if this causes pain, it may also be suggestive of central disc pathology. And then in this position, you can rotate to one side. So this loads the facet joints and should exacerbate facet joint pain. And go to the other side. If during that position bilaterally does not cause pain, it is then therefore unlikely to be facet generated pain, and relax. That position also narrows the foramina and the canal, and therefore if it was radiating pain down one side or the other, rather than paralumbar or facet pain, it would be suggestive of a radicular cause of pain. So now we'll move on to provocative tests. So if you can just take a seat for me. So we want to look for the tripod sign, the tripod test. So if one side is suggesting that they're having radiating pain or radicular pain, we'll choose that leg first. So say it's the right side. So you want to straighten the knee and elevate the leg. And that's a negative tripod test, so there's no change. Positive tripod test, we straighten the knee and leg, and she would extend her arms out, creating the tripod. Lovely. Now if you can lie back up in the bed for me. So now if the tripod sign was positive, or we're concerned for an impingement or disc pathology, we'll go on to do a further provocative test. In this case, the straight leg raise. So between 30 and 60 degrees, greater than 60 degrees can create a false positive. So if that causes pain, pain that shoots past the knee towards the foot, that is in keeping with nerve impingement or disc disease. But similarly, then we can drop where the level of pain is, drop the foot by 15 degrees and dorsiflex the ankle. This is tension sign, and that should exacerbate the pain, it stretches the nerve. Or similarly, plantar flex or bending the knee should ease the pain. If that pain, if pain is present, then that's suggestive of radicular pain from the levels of L5 or S1. If either side is positive, we can then go on to the contralateral straight leg raise. So you pick the other side of the pain, and straight leg raise. That should cause similar pain in the lumbar spine or in the affected leg, not the unaffected leg. And relax. That would be suggestive of a large extruded or sequestered herniated disc. So then if you roll over to your front, so we've looked at L5, S1 levels. So next we can do the femoral stretch in the prone position, femoral nerve stretch in the prone position. This looks at L2 to L4 radiculopathy, which is less common. So bend the knee to 90 degrees, hand under the base of the knee, and extend the hip. If that causes pain in the anterior thigh, that's a positive test. You can lie back on your back again. So so that completes the provocative tests. Next, we want to go on to neurological examination. This should be included in any good lumbar spine examination, neurological examination of the lower limbs, particularly if the patient is having any radicular pain. We also ask the patient whether they have had any change to their bowel habits, and whether they have anal sensation, and if concerned after a trauma, you should also consider to do a PR examination for anal tone. So then you can go on to check tone. So check just a simple leg roll and bend the leg up. Just let me go nice and relaxed. See that the tone is good, normal. There's no evidence of spasticity or rigidity. And then if you can take this heel to this knee and slide it down your shin for me. And up to the knee, back to the knee, and down again. So you can see and relax. And again we would do it on the other side so we can see that there's good coordination. Now we want to assess motor function. The vast majority of lumbar spine pathologies are from levels L4 or 5 or S1. So we'll be focusing the majority of this examination of these areas. So to look at the L4 motor, just bend the knee slightly and kick me away. Kick, kick, kick. So there's a good part there, and the other leg. Kick, kick, kick. So that's assessing the quadriceps and L4. Now bend the ankle towards you, so lift it up, and the big toe, and don't let me push you down. Good, and the other one, don't let me push you down. So ankle dorsiflexion is L5, and kick down as if on the pedals of the car, and plantar flexion is S1, so there's good power there. Then motor function, the other test we can do, if you can just stand up for me. So if you can just take a few steps walking on your heels. So and relax, good. And L5 weakness, the toes will drop down on the affected side. Walk back to me on your tiptoes. In S1 weakness, the heel will drop down on the affected side and lie back on the bed. Now we can continue the examination looking at sensation. So the L4 region is the anterior lateral aspect of the thigh. So you'll just let me know when you can feel me touch you.
Yeah. Yeah.
Does it feel the same both sides?
It's the same.
Then we move on to L5, which is between the first and second toes. Tell me if you feel touchy.
Yeah. Yeah.
Does it feel the same?
The same.
And S1, which is on the lateral aspect of the foot.
Yeah. Yeah.
Does it feel the same?
Same.
So again, throughout looking for any discrepancies in the dermatomes. So having done that, next we want to move on to reflexes. So the tendon hammer, we're going to start with the patella tendon reflex. So this looks at L2, L3 and L4. So we lift up, palpate for the patella tendon. Nice and relaxed for me. Good reflex. Next we go to medial hamstring reflex. So the fingers on the medial hamstring. We look for the contraction that can be seen there in the medial hamstring. Finally, we're doing reflex, bend the knee up and over the other side, looking at S1, which is the ankle reflex. So hold in dorsiflexion and tap on the Achilles, and we can see it again. So there, we can see it tap down, which is good. Now we'll move on to Babinski's sign. So this is a plantar response to a sharp stimulus. So just for the camera, we'll bring the foot over here. So on the outside, sharp stimulus on the outside of the foot in a curved motion. And a positive test is fanning and extending of the toes. And a normal test is either no response or, as you saw there, sort of clawing or flexion of the toes. Next we can go on to assess clonus. So clonus is a sustained, firm, passive stretch of the ankle. And then we can produce non-voluntary movements of the ankle. So doing that, put into the passive firm stretch. A couple of beats is normal. 4 to 6 beats is pathological. If there is a positive Clonus or Babinski's sign, suggestive of an upper motor neuron lesion, and therefore not as a result of lumbar spine pathology, and in that case, it would be imperative to do a detailed thoracic and cervical spine examination, looking for spinal cord involvement. So having completed the neurological examination, we'll then go on to do some more special tests. So we want to do the pelvic distraction. So crossing over our hands, we want to push out and down. This puts stress on the SI joints. And if it causes pain in the SI joints, suggestive of SI joint pathology. Next test is Faber's, which is we flex the leg, put it in abduction and external rotation. We stabilize the pelvis from rotating with our other hand and put the leg into forced abduction and external rotation. If that causes pain in the posterior aspect of the pelvis or the SI joints, then that's a positive Patrick's or Faber's test and is suggestive of a SI joint pathology. The last two tests we'll do look to investigate the evidence of piriformis syndrome. Piriformis syndrome can mimic sciatic nerve symptoms and is common in twisting and cutting sports. So the first test is resisted external rotation. So we flex the hip and the knee. So then pull against my fingers. So pulling against, going into resisted external rotation. If that causes pain in the buttock, that is suggestive of piriformis syndrome. And the final test is the piriformis stress test. So completely flex the hip and the knee, put it into deep flexion, and then put it into significant adduction and flexion, flexed adducted leg. If this causes pain, then that is suggestive of piriformis syndrome. Thank you. So that completes the examination of the lumbar spine. Thank you.